elbow Varus stress test is a physical examination technique used to assess the integrity of the lateral collateral ligaments at the elbow joint.
Patient's elbow slightly flexed. The therapist stabilizes the humerus with one hand while the other hand is placed on the forearm.
Elbow valgus stress test is an orthopedic test to assess the integrity of the medial or ulnar collateral ligament of the elbow.
Patient's elbow slightly flexed. A valgus force is applied to the elbow joint by pushing the forearm laterally while stabilizing the humerus.
Tinel sign is used to test for cubital tunnel syndrome, which is a condition caused by the compression of the ulnar nerve at the elbow.
The therapist lightly taps over the ulnar nerve, located posterior to the medial epicondyle of the humerus.
Maudsley's test is used by clinicians to confirm the diagnosis of lateral epicondylitis, tennis elbow.
Patient with the palm facing down. The therapist stabilizes the patient's humerus with one hand while using the other hand to resist the extension of the middle finger.
Mills test is used to diagnose lateral epicondylitis or tennis elbow.
The therapist passively stretches the wrist into flexion and pronation.
Cozen's test is a diagnostic procedure used to identify lateral epicondylitis or tennis elbow.
Patient with wrist into pronation and radial deviation while extending the wrist.
Reverse Cozen's test is used to detect pain caused by disease of the common flexor tendon at its attachment to the medial epicondyle, which aids in the diagnosis of the golfer's elbow.
Patient with arm supinated make a fist and flex wrist with a slight ulnar deviation. Therapist applies resistance against patient's wrist flexion by exerting a downward force.
Medial epicondylitis test is a method to assess for golfer's elbow.
Therapist palpates the medial epicondyle with one hand, then passively supinates the forearm and extends the elbow and wrist.